Assalamu alaikum dear students, welcome back to my YouTube channel. Today we will discuss top 50 nursing MCQs part 4. The enzyme that breaks down carbohydrates in saliva is option A pepsin, B amylase, C lipase, D trypsin. Correct option is B amylase. Which electrolytes imbalance is seen in hyperparathyroidism? Option A hypocalcemia, B hypercalcemia, C hyperkalemia, D hyponatremia. Correct option is B hypercalcemia. A patient with liver cirrhosis is at risk for option A hyperglycemia, B jaundice, C bradycardia, D hypertension. Correct option is B jaundice. Which condition is most commonly associated with COPD? Chronic obstructive pulmonary disease. Option A asthma, B tuberculosis, C emphysema, D pneumonia. Correct option is C emphysema. The classic symptom of appendicitis is option A left upper quadrant pain, B rebound tenderness at McBurry point, C severe headache, D hematuria. Correct option is B rebound tenderness at McBurney's point. The antidote for heparin overdose is option A vitamin K, B potassium sulfate, C naloxone, D atropine. Correct option is B protamine sulfate. Which of the following is a loop diuretic? Option A hydrochlorothiazide, option B furosemide, C spironolactone, option D metoprolol. Correct option is B furosemide. The common side effect of opioid analgesics is option A hyperglycemia, B constipation, C tachycardia, D diarrhea. Correct option is B constipation. Insulin is primarily used to manage option A hypertension, B diabetes mellitus, C hyperthyroidism, D epilepsy. Correct option is B diabetes mellitus. Which antibiotic is most commonly used to treat urinary tract infections, UTI? Option A amoxicillin, B ciprofloxacin, C metronidazole, D tetracycline. Correct option is B ciprofloxacin. The largest gland in the human body is option A pancreas, B liver, C thyroid, D adrenal. Correct option is B liver. The functional unit of the lungs is called option A nephron, B alveolus, C bronchioles, option D pleura. Correct option is B alveolus. The universal donor blood group is option A positive, B positive, C AB negative, D O negative. Correct option is D O negative. The longest bone in the human body is option A tibia, B femur, C humerus, D radius. Correct option is B femur. The normal pH of the urine is option A 2 to 3, B 4.5 to 8, C 8 to 10, D 10 to 12. Correct option is B 4.5 to 8. The hormone responsible for water reabsorption in the kidney is insulin, B ADH antidiuretic hormone, C oxytocin, D cortisol. Correct option is B ADH antidiuretic hormone. The tube that carries urine from the kidneys to the bladder is option A urethra, B ureter, C renal pelvis, D nephron. Correct option is B ureter. The primary function of the kidney is digestion, B filtration of blood, C hormone production, D bile production. Correct option is B filtration of blood. The longest part of the digestive system is option A stomach, B small intestine, C large intestine, option D esophagus. Correct option is B small intestine. The enzyme that breaks down carbohydrates in saliva is option A pepsin, B amylase, C lipase, D trypsin. Correct option is B amylase. The primary muscle responsible for breathing is option A intercostal muscle, B diaphragm, C esophagus. Correct option is B diaphragm. The neurotransmitter responsible for muscle contraction is dopamine, B serotonin, C acetylcholine, D adrenaline. Correct option is C acetylcholine. The part of the nervous system is control involuntary action is option A somatic nervous system, B central nervous system, C autonomic nervous system, D peripheral nervous system. Correct option is C autonomic nervous system. The heart is located in which cavity? Option A abdominal cavity, B thoracic cavity, C pelvic cavity, D cranial cavity. Correct option is B thoracic cavity. Subscribe now and press the bell icon. Never miss an update from early technologist. The first priority in treating a burn patient is option A pain management, B fluid replacement, C infection control, D nutrition. Correct option is B fluid replacement. The largest muscle in the human body is option A sartorius, B quadriceps, C gluteus maximus, D deltoid. Correct option is C gluteus maximus. Thank you for watching my videos.